2.5 weeks ago, we marked the anniversary of 9/11, including the bravery of the first responders who rushed in. In the years that followed, the general public has learned more about the dangers faced after the disaster by the many firefighters who became sick working in Ground Zero. Now, 20 years later, much more is known about those cancer hazards that come from fighting fires, but there's still work to do to help those heroes long after the fire is out. Here's Rolly Hoyt.
It's really amazing to see the percentage of people that have colorectal cancer, thyroid cancer, throat cancer, and the numbers are just devastating.
Over 20 years, a culture change has swept over the fire service, born in the deadly aftermath of September 11th, a change illustrated by names on memorial walls across America.
2015, 157 names went on the wall, with 114 of them being cancer. So 72% of the names put on the wall in 2015 were cancer related.
Those stats, delivered by Curtis Dunn of the Firefighter Cancer Support Network, speak to a crisis that many, even in the fire service, were slow to recognize. These men and women sign up to handle crisis. They rush into burning buildings. But it's taken some time to recognize that working amid smoldering, damaged buildings surrounded by cancer-causing gases is just as dangerous.
It's something that now we're all aware of versus, a decade ago when I first started in the fire department.
Matthew Stallings is a Little Rock firefighter and one of the leaders in their union. They've worked to educate their brothers and sisters about cleaning their gear and decontaminating after a fire. And they've also worked to win support from lawmakers because the costs of this crisis are expensive now and in the future.
If you're a city administrator, if you're a homeowner, if you're a business owner, if you're a firefighter, we're all stakeholders in this.
So now there's something called Crump's Law. It recognizes cancer as a line-of-duty illness, sets up a disability system, and provides additional leave to fight the disease. But Stallings and Dunn point to another need: financial support.
There's so many GoFundMe pages out there, Raleigh. There's so many places that people go to credit unions and try to set up things for these people.
How do we help, volunteer guys? And so that's how the Arkansas Firefighter Cancer Relief Network Trust Fund was born.
It's a charitable fund set up by the legislature, but it's taken some time to actually fund the fund. The main source has been through annual 9/11 events like a stair climb and a 5K race. Now it's time to take the momentum from the 20th anniversary. Both the national and local groups are poised to help firefighters become cancer fighters.
We would like to see a point where we're not only necessarily taking care of the firefighter who gets sick, but hopefully we can offset any costs that are incurred, based on his absence.
It's good to have somebody that can tell you, hey, I had what you had and I survived.
Because we recognize that there's always going to be a need for firefighters to go into burning buildings to put out fires, and that's not going to change. Through all the awareness that we have, we know we're going to continue to get sick at a higher rate, but we're all still here. We're all still doing this job.
Rainwater Holt & Sexton presents this $1,000 check and the Saluting Heroes Award to the Arkansas Firefighter Cancer Support Network. Arkansas firefighters, we salute you and thank you for keeping our communities safe.